Hi, I'm Trisha, and I am in charge of dental sleep medicine for all of the practices under Silver Creek Dental Partners. I want to talk about our process we have for engaging our patients in the dental sleep medicine program and how we talk to them about sleep apnea. I went over a PowerPoint presentation with each office, sort of an intro to sleep apnea, to get everybody on the same page and understand exactly what sleep apnea is and how we can talk to our patients about it. So what I would like to see happen is more of those conversations happening at the office level. Oftentimes, patients are screened with the sleep questionnaire and sent to me immediately. What happens when I call those patients is they don't answer. It's a strange phone number. They don't know who I am or why I'm calling. I do send emails to those patients with a lot of information about the oral appliance therapy that we offer, but again, they don't know who I am. So if we can do more of those conversations at the office level, I would be more than happy to review sleep apnea with you, what it is, what the symptoms are, and what we look for in our patients. Because truthfully, the patients trust you, their doctor, the staff. They know you and they trust you. The more education that you have as far as sleep apnea, the more information that you offer them, they're going to accept treatment. But when a stranger calls, they're not really listening to me. Once we get to the point where I might be needed to intervene and get involved with the patient, we're fine with that. First of all, after you've had your discussion with your patient, let's say the dentist comes into the hygiene room and says, "Oh wow, it looks like you have a very large tongue. I don't see very much of your airway. I'm seeing wear facets on your teeth or patterns of clenching and grinding." That's a real good opportunity to say, "Hey, I think you might have a sleep disorder or some sleep disordered breathing, or you're at risk for sleep apnea." However you want to phrase it in your office, but let them know that as your doctor, there's concern. Once that concern has been addressed, we want to get a copy of the patient's medical insurance card. Take a look at that card. We need to know if it's going to be a PPO plan or an HMO plan. If it is HMO, we do not file HMO insurance just like in dental. So HMO insurance is going to be a cash price. The nice thing about this is you don't even need me to get involved at this point. You should know what the cash price is for your office. If you do not, let me know and I'll make sure you know what that is. You can quote the patient that price. If they are ready to go and say, "Yeah, that sounds good, let's do it," you can do same day treatment. You don't have to wait for me. Where I need to get involved is if they need a sleep study. If that happens, they will need to be put on that tracker. Well, they'll be put on the tracker no matter what if we're doing treatment of any sort. But put them on the tracker and under the sleep study column say needs a sleep study. Then I will contact the patient and I will get that sleep study out to them. Again, if this is an HMO policy, we will not be able to bill their insurance. It will be the sleep study cost of $250. If they have insurance and they want that to be run through the insurance company, we can do that. We need to do an insurance verification. And again, once we get to that point, then let me know who those patients are on those trackers that I trained you on, and I will get in touch with their insurance company. I will contact the patient, make sure it's okay that we do a verification, get the verification done. And that typically takes 2 to 3 business days to get that information back from our biller. Once I have it, I let the patient know what they will be paying for the sleep study and what they will pay for oral appliance. As far as sleep studies, it's a real good idea for us to do a sleep study on any patient going through treatment. Now, if this patient has had a recent sleep study or a sleep study in the past, and they know they do not have sleep apnea, but they have a snoring problem, then we can treat them for snoring. The snoring fee is much less than the sleep apnea fee. So we charge about $1,500 right now for snoring, and we charge about $2,200 or more depending on the office for sleep apnea treatment. So the snoring treatment is less expensive because it's less follow-up appointments. We don't have to keep tabs of those patients quite as much. So back to the sleep study. If they have a sleep study and we're using insurance, so they have a PPO plan, we need to run an insurance verification as far as what the sleep study will be covered, if at all, and as well as the oral appliance. Those HMO policies, again, we don't file it. Those patients will need to pay for their sleep study and their oral appliance. If they do not know, they've never had a sleep study, we definitely need them to take one. We need to know, are we treating just snoring or is there sleep apnea? So if there is sleep apnea, we want to make sure that we diagnose that patient properly and treat them properly so that we don't miss something and become liable for neglect of a patient. We're going to talk about the process that we go through for our sleep patients. Whether it's snoring or sleep apnea. We'll just go with more of a sleep apnea process here. So for referred patients coming from outside of our practice, from an ear, nose, and throat doctor, a cardiologist, a pulmonologist, a primary care physician, what will happen sometimes if they're coming through me, I might be able to have their insurance verification complete before they ever have an appointment in the office. If that happens, I will have not only the verification done, but I will have the financial arrangement also complete. So once we get that referral, I will contact your office and say, hey, we have a new referred patient. Let's get them in for a no charge free consultation, sleep consultation. That appointment is about an hour. So when the patient arrives, the new referred patient arrives for their appointment, we want to make sure we get a copy of their medical insurance card. The first thing that happens, they will be brought back to the operatory and the dental assistant will do an iTero scan of their mouth and their natural bite. The doctor will come in and do the doctor examination and consultation. This is when all of the discussion of sleep apnea occurs. The doctor might say, hey, you've got some missing teeth and this is how this relates to sleep apnea. If you have a CBCT scan in your office, it's a real good idea to put up a sample scan on the video monitor. Split screen, so one screen showing a very constricted, narrow airway. You can usually highlight it in red so that the patient can see what the airway is. And then the other side of the screen would be a great idea to have a nice open, wide airway, possibly even a CBCT of someone who has an oral appliance in their mouth. It's good for the patients to see that the change in their airway, that the oral appliance does work, and that they do have options other than CPAP. So once the doctor examination and consultation is over, the doctor will then take the protrusive bite on the patient. So make sure there is a George gauge in the room so that the doctor can get that bite done. Once the bite is done, the doctor is finished with his consultation or her consultation. The dental assistant will scan that protrusive bite, hand the patient the sleep packet, which has all of the forms we need the patient to fill out for their insurance claim or just to have the oral appliance. Sometimes, in fact, even if we are not filing insurance, we do need to have these forms filled out. At that point, if the insurance verification and financial arrangements have not been done, send those to me and I will go ahead and get those both done. Verify the insurance plan. I will make the financial arrangement with the patient. If we go that route where we're doing it after the appointment, once I have all of the information, I will send it to the office, and then the office calls the patient for their payment. They will know you're going to call, and they know that they will pay their patient portion in full. If there's any questions, always feel free to reach out with me on that, but we want to make sure we get that payment done full before we send the case to the lab. So once we have it, we do send that case off to the lab. They don't need to come back because we did everything in that consultation and the records appointment. So it's all done, it's all ready. We just send it right out to the lab. Their next appointment will be for delivery. The process for snoring and sleep apnea is a little bit different when it comes to our patients of record or the patients who are already patients in our office, established patients. We likely will be seeing these patients when they come in for a hygiene exam and checkup, or any hygiene appointments or a dental appointment. What we want to do is we want to screen all of our patients when they're coming in for these appointments using the sleep apnea questionnaire, ideally using the QR code, which will make a lot less work for you, or we can give them a paper form, or they can do it via RevenueWell. So once they're in for their hygiene appointment or their dental appointment, every person on the staff has a job. So the front desk needs to be able to speak about snoring and sleep apnea and know the differences. The dental assistants, the same thing, they're chairside with that patient, especially if the doctor steps out of the room for a little bit. It's a great time to have a conversation about that, especially if the doctor has initiated it. Hygiene is real important. Hygienists are in the airway. When they're doing oral cancer exams, it is the same exam to look for airway issues. We're looking at the same wear facets down the back of the throat, the tonsils, the tongue, we're looking at the same thing. So just change your train of thought to look for oral cancer as well as airway problems. If the doctor comes in to do a hygiene check, that's a great time for the doctor to plant that seed. We know that the doctor has limited time doing those hygiene checks, so we want to make sure that the hygienists are educated as far as sleep apnea and engaging those patients. We want to make sure that if that patient is interested in saying, yes, I think I should have a sleep study, you're right, let's get that ball rolling. We want them to fill out the sleep packet, which will have the necessary forms. It will get their insurance information. Remember again, if their insurance is HMO, please ask them. If you don't know and can't tell by their card, ask them. They will know. If it's HMO, we can sort of just stop the presses right there. It's going to be a cash price patient. If it is a PPO plan, make sure we get all of that information, a copy of the card, and you will send that to me. I'll do the verification. I will get their benefits verified. I will get their financial arrangements made. Once I have all of those forms signed and the patient has agreed and accepted treatment, then I will send it back to the office. We will get them back in for the records appointment. Depending on how old their scan is, their iTero scan, we may need a new one, and we definitely need the doctor to come in and do that protrusive bite with the George gauge, and then that patient is ready to go to the lab, as long as they've paid their portion in full. I'd like to offer some clarity on our process for our sleep apnea and snoring patients. We will start with screening our patients. So we'll talk about the questionnaire first. So there's one of three ways our patients can take that questionnaire, the sleep questionnaire. The first way, which is going to be the easiest for everybody, is going to be to use the QR code. That way those responses are auto-populated into a spreadsheet and their scores are calculated for the doctor to easily see what their scores are and recommend what type of treatment we need to do for them. Second way we're able to get that questionnaire out to the patients is by the Revenue Well campaign. I know a lot of offices have the sleep questionnaire in with their new patient paperwork, and that is also fine. Problem with that is it takes just a little bit more effort on the doctor's side to take a look at those scores. He has to actually, he or she has to read every single response and evaluate the patient that way. The last way would be a hard copy. Hard copies are used for our patients that don't know what a QR code is. Maybe they are 85 years old and don't have a cell phone. So hard copy is also acceptable. So once we have the sleep questionnaire filled out in one of those three ways, we want to look at those responses, have the doctors evaluate to see, do we need to contact this patient? So no matter what the scores are, we need to review the results with the patient. So if they have nothing going on, they don't have any symptoms or very, very low scores, all we need to say to them is, hey, thank you for taking our survey. It looks like you're really not having any sleep issues at this time, which is great. If anything ever changes, please let us know. And then we might want to screen them in a couple of years. The other thing we need to watch for is, do we have consent to speak to them if there is a risk for any type of sleep disordered breathing? That is the last question on the questionnaire that says, do you agree to let us contact you? And if they say no, then we don't say anything. If they say yes, then we want to have some conversations with them. So we want to let them know if they are at risk. So the way we would do that, if we have consent from that patient, is we want to go over their responses. So maybe they've checked yes that they snore or that they clench or grind their teeth. So that's a great time to have some conversations with them. And if you're unsure of what to say, that's what that intro to OSA presentation was that I gave to each office. That's where you're going to find that information. So, hey, patient, it sounds like you have a snoring problem, or people complain that you snore. That could be because of your airway. And explain what happens. The airway constricts. The tongue falls back into the airway. The airway becomes very small. All the tissues in the back of the throat start to shake and vibrate, and that's what a snore is. If they're clenching and grinding, explain to them why they might be doing that. If their airway is blocked off or choked off because the tongue is obstructing it, they might be clenching their teeth in a fight or flight mode to reopen their airway. So go through all of their symptoms with them and say, oh, this could be because of this. And if you're falling asleep during the daytime, you're having a hard time staying awake afternoons at work, it might be because you're very tired and you're not sleeping well, because patients really don't know if they're sleeping well or not. because even in that light stage of sleep, they are still asleep. Something else to keep in mind is we don't really want to say a patient has sleep apnea unless we know for sure they do. So the only way to know that is if they've had a sleep study. Once they've had a sleep study and their score is over 5, we can definitely say they have sleep apnea. But up until that point of knowing what their score is, we can't say it. We can say sleep disordered breathing. We can tell them they are at risk for a sleep disorder, but you can't say apnea till we have a diagnosis. Now, let's say we have a patient who has been diagnosed with sleep apnea and they're on CPAP. So we want to find out, do you like CPAP? Is it working for you? A lot of them might say, yeah, they're fine with it. They like it. Other patients may hate it. No, I don't even wear it all the time. Those patients are at risk. If they have sleep apnea and they're not treating it, that's a problem. That is a life and death problem. So what we want to do is for those CPAP patients, even if they like their CPAP, just say, do you know that we offer an alternative to that? We can put you in an oral appliance. So rather than having all that force of air down your throat, you can just wear this oral appliance at night. It'll keep your airway open and it's a little more comfortable. For those patients that hate CPAP, they will listen to anything you have to say. They're going to be very interested. So now for our patients who have never been diagnosed, are interested in what we're saying. We've talked about their symptoms. We've explained what the oral appliance will do to help them. We need to get a sleep study. Any patient who's had a sleep study within the last 3 years is good to go. We just need to get a copy. They can sign that medical records release, which allows us to ask for it. They themselves might have a copy of it and they can just give that to us and we'll get it scanned into their chart. If they have a sleep study or never had a sleep study, like I say, the sleep study needs to be within the last 3 years. If not, we are happy to do one. It's a very easy process. We do home sleep studies. The cost for our sleep studies is $250. You can tell your patients that's a great price and that we are not profiting on that because we have to pay a sleep doctor to interpret it for us. And we also have to pay for the unit itself, the sleep study itself. So we are not profiting on our sleep studies at all. We charge a lot less than if they were to go through their primary care. Now, if they've met their deductible for the year on their medical insurance, they might want to go through their primary care because it probably won't cost them anything. But they have to get an appointment with their primary care. They have to get the sleep study issued. They have to take it. They have to wait for the results. Ours are done with everything can be done within a week. We send them out right away. They're coming from local in San Diego. So we put them in the mail them straight to the patient's house. So I hope that clears up a lot of the confusion. If the process is not clear, please know you are always free to reach out to me via text message or a phone call or an email. Thank you.